and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Pho, founder and editor of KevinMD. Today in the show, we have Michelle Lee. She is a radiology resident and she wrote the KevinMD article, Bystander Intervention Training Can Save a Life. Michelle, welcome to the show.
Thanks for having me here. I'm so excited.
So we'll get into your article in a little bit, but first off, can you share your story and journey to where you are today?
So I'm a native New Yorker. I was born in Queens. I went to high school on Long Island. I went to medical school in Manhattan and Cornell Medical School, and then I did an internal medicine year at Sinai where, it's a very demanding intern year, especially during COVID. And I kind of became realizing my identity as a resident trainee. And this was also kind of with the escalating anti-Asian hate crisis, I guess, especially during COVID, I became a community activist for the AAPI community, the Asian American Pacific Islander community. And kind of during my advocacy work for the community, I realized how important bystander training intervention can be and also saving a life. So I wanted to share a little bit about my experiences and also what I learned from the process.
Could you share some stories and your experiences being an Asian American, especially during the pandemic?
I'm a first generation college student, and for the most of my life, I feel like I've been always trying to get here, which is, being a doctor. And I realized more and more, and that's something my parents always told me because they were not college educated, and they're like, once you become a doctor, things will become easier. And I'm quickly realizing that there's so much, as awesome as incredible this field of medicine is, there's so much I'm realizing I have to learn, but also how much power I have within the white coat. And I realized a big part of, reaching that American dream is not just becoming a doctor, but really giving back to the community. And when I was an intern in internal medicine, I was frankly pretty burnt out this time last year. And then when the COVID pandemic hit, I felt like really a call of arms. I felt the need to serve my city. And I was in the trenches with so many incredible people and other fellow healthcare providers who, we were not seeing our families for 9 months. And I felt like that was a true creating of my doctor identity within that COVID pandemic. And I think these stories were not very covered often in mainstream media, but, burnout and, how frankly traumatizing that experience was. And I think more and more of us are just finally starting to process that. But I wanted to also talk about a different perspective as an Asian American in New York City, because, I'm a native New Yorker, and I realized the city was really changing because there was an increase of violence against the Asian American Pacific Islander community. And I was noticing that even as a doctor on the front lines, because I would hear about, a fellow co-resident that was spat on the way to work. And she was clearly scrubs and, she was going to actually treat COVID, but people were scapegoating the Asian American community as harbingers and, of disease and the virus. So whatever trickle-down effect from political rhetoric, unfortunately, was kind of playing out and putting members of, my community into the hospital, or these acts of racism. I wanted to raise awareness that racism is a public health issue. And I think more and more of us are realizing that, especially after George Floyd and kind of the wave of political activism afterwards. In New York City in particular, the rate of violence has increased, almost over 200%. So it was definitely this last year, it wasn't just the COVID pandemic, but it was also the anti-Asian racism that was a huge stress to Asian American healthcare workers within the city. So I wanted to raise awareness about that.
So tell me some of the things that you did to raise awareness about the anti-Asian sentiment that was going on.
So after the Atlanta shootings in March, which involved, 6 of the 8 victims were Asian American women who were targeted because they were working at massage parlors. So there was a lot of outrage after that. And I realized, I was a part of, when I was at Cornell Medical School, I was a part of White Coats for Black Lives. Even as an intern, I would march, after a night shift to protest George Floyd's murder. So I realized, we need to finally advocate for our own community. So I rallied the first White Coat Frontline for the Asian American community. We had over 100 healthcare workers come out to Columbus Park. It was the largest AAPI rally. I was able to speak on the same stage as Senator Chuck Schumer, mayoral candidate Andrew Yang, a BLM activist, and also I used my platform, to actually amplify a story about a Sinai medical student, Natty Jerome, who's Thai, but was actually beat on the way to the hospital because she was called Chinese virus. And I think a lot of Asian American healthcare workers have been reporting instances of harassment, just even when they're wearing scrubs, just because of that scapegoating and racism. So I did a lot of work, not just community activism in terms of rallying the community, but also within the hospital, which is educating the NYP, New York Presbyterian GME. And luckily, it was AEPI Heritage Month, like shortly around this time. So the hospital was very willing to actually give me a platform, and I was able to speak at NYP diversity meetings, and also talk at Stony Brook, and also a medical school at Mercer College of Medicine in Georgia. A side gig of mine is actually writing, and I've been covering the Asian American community in New York City for like 8 years now, just as a side gig. And I finally realized that my role as a doctor is, it's not like my parents said, which is just to study and make it. It's really so much more than that. It's realizing the power you have, even as a trainee, to advocate for your community, and using that voice and that education, which is so hard won, and built on immigrant sacrifice, to actually give that voice to the immigrant community who are unable to advocate for themselves. So it was an incredible journey. I was able to write so many articles on behalf of the community, including the KevinMD article, but I interviewed, Stop API Hate co-founder Dr. Russell Jung, who is an Asian American professor, department chair at San Francisco State. And I asked, what are 6 things we can do to help the Asian American community? And I was able to, with my writing skills, with my education, I was able to, write an NBC article amongst others. And I think this is my coming of age as like a resident trainee, and realizing there is so much work to be done in terms of community activism as doctors that we should really start to get involved with.
Now, for physicians who want to become more of a voice, who want to participate more in activism for a variety of causes, a lot of physicians, they don't have a lot of training when it comes to this. How did you learn how to write, how to amplify your voice, and how to do the activist things that you do? Where did you learn how to do all that?
Honestly, so it's fascinating, because now there's there's anti-racism and diversity fellowships now people can do. It's becoming more and more of a recognized issue, like diversity in medicine and inclusion, and they're doing increased training. And I honestly didn't get much training from that, except for just going to Cornell and being around like-minded students who are passionate about social issues, but sometimes feel too scared, either career-wise or overwhelmed with the actual medicine part, to have not feel like they don't have time to make this priority in their training. But I think for me, I've always covered it. I'm from, my family are Asian American immigrants, and they have a store in Koreatown. They're local business owners. So it was truly like the Atlanta shootings, and I've always written just kind of as like a stress relief for me. It's just more for, but it was truly the Atlanta shootings where it was local, hardworking Asian American immigrants, business owners, and that just really struck a really personal note. I think that's what really, many of us go into medicine because of our personal experience or encounter. I think that particular news, and then opening up so many news articles and realizing they were not covering my community in maybe a holistic manner. They, even hesitated to call out racism as a key motivator in this. And I realized, how are we supposed to treat, instances like this if you don't properly diagnose them? So I realized, calling things out and recognizing acts of racism and getting, professional organizations to also denounce it is very critical in making members of the community feel heard and, their concerns being taken seriously. For me, it was just honestly, frankly, I think it's just being in New York City and being, where there's so much high density in instances of this, and hearing these stories is just simply amplifying it in the way I knew best, which is covering them and writing about it and publishing and, sending it to places like KevinMD, who will give a platform to physicians who want to share, these stories that are not often heard.
So let's transition now into your KevinMD article that you wrote. It was written back in May. It's titled Bystander Intervention Training Can Save a Life. Now, for those who didn't get a chance to read that article, can you just walk my audience through it and share the story of why you decided to write it?
Yeah, so I decided to write it because, there was a heavily publicized, there was, at least in New York City, there was a hate crime committed on a medical student. And one of the things she taught, I reached out to her immediately and I said, "Are you okay?" And I've been kind of her mentor, and I helped her mentor some pieces in media as well. And, the one thing that struck out to me when she told me her story was, she's like, there were people around, but they didn't know what to say. They didn't intervene. And she was really severely beat to the point that she had to take time off school. And similarly, we kept getting a deluge of anti-Asian hate crimes in the New York City media, and including one of them was Velma Kari, who's a Filipino woman who was just walking to church in broad daylight, literally 10 blocks from the hospital I used to work at for intern year. And it caused a lot of outrage because she was beaten to the point where she had her pelvis fractured. She got a concussion, and it was outside of a luxury building, and the security guards just closed the door on her. They didn't call for help. So, as a medical provider who would probably see the downstream effects of this, like either I would be reading her film, I felt like it was part of my, also part of my doctorate duty to educate people on, simple bystander training intervention. And that's something that secondary professional organizations have already been doing, but just really that education needs to be, I think it's a good thing to educate the mass public about it, because it's very easy, and I can go into specifics in a second. It's very easy, and it could really truly save a life, especially as, unfortunately, with a lot of economic displacement from COVID, and there has been increased crime rate, not just in New York City, but nationally. So the whole idea of bystander intervention is to acknowledge and also potentially intervene to help a person in need. And that goes for not only like hate crimes or any kind of crimes, but also when they're in medical duress, and also when they're in cases of, even a woman, gender-based discrimination. So my article was simply, if it's kind of like in basic medical training when you're learning to run a code, and during it they tell you first assess, is the scene safe? So if it's obviously too dangerous for you to intervene, or you think you're going to be put at risk, you obviously don't need to intervene. But one of the critical thing that the security guards at that luxury building, and I was involved in a lot of the rallies and peaceful protests that happened in front of that building, was actually just simply educating bystanders who simply aren't trained, and it's not truly their fault, which is, even if it's not safe, you can always call for an ambulance, you can always call for help. If you see someone being attacked, or you see someone being under potentially having serious medical repercussions, in her case, it was a fractured pelvis, it was a head concussion and a contusion, then we should simply call for an ambulance. And that's something that's very simple, and that's something that we can do. Call 911, don't just walk by. And bystander intervention is actually a larger topic. My favorite one is from I Holla Back, which after hearing about a lot of these instances, I took a training course with them, and they call it the 5 Ds of bystander intervention, which I really like. And basically, the 5 Ds for bystander intervention is, potentially distracting the person, which is just trying to de-escalate the situation but of course, just check that the scene is safe for you, and just do whatever you can to help the victim get in their way to safety. That can be delegating, or calling, or making eye contact with another person in a public setting and saying, can you call 911? Are you able to go and help the victim if you feel unsafe? Are you able to direct the police car to here if they're able to? The third one is to document, and of course it's not safe to document if you feel like you're going to disempower the victim, and you should obviously not post anything if it's going to disempower the victim without any person's consent. But you can document it, an incident, and maybe that will help that person. Like for instance, if you see someone acting in a way that you're unfamiliar with, maybe they're having a seizure, simply documenting it and just showing it to the medical provider might help them later on. Fourth is to delay, which is if you notice someone being harassed or being a potential victim of any sort of harm, you can potentially try to delay the perpetrator. And then, of course, the last one is going to be directing, which is once the ambulance or once the police force gets to the area, you can just direct them to the victim in need and get them to safety in whichever way you can. So I think that's something that I learned that was very helpful. And, even in New York City, it just isn't as safe as it used to, because the city it's still recovering, but still pretty empty. And, there has been increased crime. So I think about these 5 Ds whenever I take the subway or bus to work.
Now, with your interaction with the medical community, what's their level of knowledge when it comes to bystander intervention? Do you feel like that they can use more training, or do you find that a lot of physicians kind of already know what to do?
I think a lot of physicians need training on it, and I've had a lot of diversity chairs reach out to me about bystander intervention training, especially during AAPI Heritage Month, because a lot of even Asian American healthcare workers were being unfortunately assaulted just taking the subway to work. Or I talked to a nurse who was punched in the stomach, and it happened so quickly, and they just want to move on with their life, so they rarely report it. So a lot of these things are underreported, but bystander intervention training is something that a lot of people are interested in, because it's one thing that it's something that we can teach, and it can make people more aware about their surroundings and potentially help someone. Because it can be very disempowering for a healthcare worker, and that's why I felt like it was important for me to speak up, because I had busted my butt during intern year, right? And I was working around the clock, just socially distancing from my family. And I was seeing my community being scapegoated. So I felt like it was very ironic, and it's something that, and especially if you are a healthcare worker who don't feel safe going to work, or you have been a victim of either verbal or physical harassment or assaults, then it can be very disempowering and very demotivating to go to work and bust your butt and yet feel not safe when you're outside the hospital.
And if people wanted to find out more information on bystander intervention training, where can they look that up?
One would be a KevinMD article, because at the end I link I Holla Back, which is one of the many, but one of the best I found. It's very quick. It's a 1-hour training, but they also have like pamphlets and very easy pictures, like for the 5 days. Even in New York City, there's a lot of local community organizations. Like, for instance, there's a cafe called Cafe Maddie Cab, she's just a local business owner who felt unsafe going to work and felt like that was a very common concern within the Asian American community. So she raised over $200,000, and then she reimburses cabs for local New Yorkers simply going to work, and many of them include essential workers. Biggest takeaway I learned from the last few months is you can always make a difference. I think when you're undergoing a lot of hate or difficult circumstances, I think education and just simply being caring and empathic and doing whatever small difference you can really actually do make cumulative big differences in the overall picture for the community.
We're talking to Michelle Lee. She's a radiology resident, and she wrote the KevinMD article, Bystander Intervention Training Can Save a Life. Michelle, as part of your story, you mentioned that you've been covering that intersection between Asian Americans and medicine for years now. Now that you have a platform here, what would you say is the biggest misconception about Asian Americans in medicine? Asian Americans
on the surface seem overrepresented in medicine, and that's as a result of the 1965 Immigration Act, wherein the U.S. specifically selected for high-achieving STEM. And many of the Asian Americans we see in medicine today are as a result of that. However, the biggest misconception is that Asian Americans are a model minority and that they're a monolith. And in fact, in medicine, there are certainly many Asian Americans who are underrepresented. I would say Southeast Asians, Hmong, Cambodian, Filipinos. Many of those Asian Americans are actually underrepresented significantly, and it's that Asian Americans are the fastest growing but also highest economically divided racial group. So the model minority, which is from that 1965 media that was perpetrated by a very specific kind of white male media outlook, which is that Asian Americans are quiet, hardworking, high achieving, they don't experience racism, they don't have any difficulties, and they technically made it. That's completely untrue, because the Asian America in 2021 looks very different. We have Asian Americans of over 30 different countries who speak very different languages and also have come from very different socioeconomic backgrounds. Certain Asian American groups like Chinese and Indian groups might be their average income may be 6 figures, but Southeast Asians, their average income might be $30,000. So a lot of Asian Americans, even within medicine, that the admissions criteria has not been really truly disaggregated. That's something that I hope to raise awareness for, which is that certain Asian American groups are considered on the same playing field as others, and that's not really the case.
And my final question: what's your take-home message that you want to leave with the KevinMD audience?
My take-home message is that even if you're a resident trainee, just trying to figure things out, you can always make a difference. And no matter how busy you are, it doesn't take much to advocate or speak up for your community, because it does make a big difference.
Michelle, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thanks so much, Kevin.